My surgeon, my doctors told me a number of years ago that their desire was to do no harm. And I feel that that is the goal of the medical profession, is to do no harm. But things happen, and I'm now an AKA, that's above the knee amputee. See how pretty it looks? I have a C leg, which I'm very proud of. However, it didn't start out this way. When I was 53 years old, I'm now 61. When I was 53, they wanted to do a knee replacement. Told me that they were just really the new thing. Really, people did very, very well with them. So in 2001, I had a knee replacement. It wasn't successful. We don't know exactly what happened, but see, I had the knee replacement on November 1st, excuse me. I had it November 1st, and on Thanksgiving Day, I was sitting at the Thanksgiving dinner table with the family, and I said, you know, I'm going to go up and take a nap. I just don't feel real well. I thought it was because I'd eaten too much dinner. My wife came up a few hours later after the family, and I was febrile. I wasn't feeling well. The next day, Friday, my fever went very much higher, and she wanted me to go to the doctor, and I said, no, I don't feel well enough to go to the doctor. And she's a nurse practitioner, by the way. On Saturday, she insisted I go to the doctor, but that was okay. I was out of my mind with fever, and anyway, so she called 911, and the ambulance came, and that afternoon, they took my knee out. They left my knee open for, I don't remember, it was about 6 weeks. They left the knee open, and then they put another one back in, and away we go. And I was fine for about a year. A year later, it wasn't working, and I was sick again. And they decided, well, let's take it out and do another replacement. This went on, to make this story as short as I can, I had 4 total knee replacements, all due to infection problems. Before my amputation was just 2 years and 2 months ago. Let me just give you a little bit of the perspective from a patient's standpoint about what happens in the do no harm situation. My first knee replacement, as a for instance, I was in, this isn't, by the way, I don't mean to be against any physician's practice or any hospital specifically. This is my view and my somewhat indictment of the healthcare system of nurses and healthcare practitioners that are in such a hurry to do their job because they're understaffed. I don't believe that healthcare professionals are in any way not caring. I just believe they're in too much of a hurry to do the job and underpaid. The insurance companies don't want to pay enough to pay the doctors to do their job correctly. The hospitals are way understaffed. My night nurse, the day of my surgery, my first knee replacement, was right out of school. She was the charge nurse on the floor of orthopedics. And about midnight, it was time to change my, what do they call it, my pain pump, my morphine pump. She didn't know how to do it. And I said, well, I'm in pain, you know, you've got to do something. She said, I don't know how, and there's nobody here to tell me how to do it. I sat until morning after whatever the nurses do first thing in the morning after they have their meeting, and then they came in and changed my pain pump. I was very, very uncomfortable by that time. Experience, therefore, and training has a play in what we patients certainly see and feel. I went all night in a very uncomfortable situation. Where I got my infection originally, who knows? My wife did notice, however, that after the first knee replacement, that they didn't change the sheets in the room. They changed the sheets on the bed, but then left them piled in the corner, for instance, of the hospital room. They were still there when I left. That was 2 days, well, about 72 hours total later. She feels, as a nurse practitioner, that probably shouldn't have happened. As a patient, I don't know how often they're supposed to remove the sheets from the floor, but I don't live that way at home. Do you? Anyway, I don't know where the infection came through originally, but I know that it did. It could have come through in my own home, I suppose. We just don't know. but I got the MRSA, or a staph. They told me it was a staph infection at that time. We weren't using the MRSA term, I guess, at that point. 4 knee replacements later, and from 2001 till 2006, they finally decided that it was time to cut the leg off. Now, my doctor did not want to cut the leg off. He told me, I don't want to do harm, and that's doing harm. Let me fix it again. Let me fix it again. My wife and I just had to put our foot down and say, both feet at that time for me still, but put our feet down and say, no, it's time to do something else. I can't take the I can't take this number of surgeries. I can't take the pain. MRSA infections with a knee problem is very painful. I was in exceptional pain for a number of years there, from 2001 until 2006. I don't know what to better do. We saw another practice, got a second opinion at the recommendation of my surgeon. The other surgeon that he recommended said, yes, it's got to come off. There's little choice. We could replace it, but it's going to come back again. It has 4 times. So they cut it off in September of '06. I think you can see that I'm doing quite well now. I walk around. I still have trouble getting up on a stage, perhaps, but that's coming too.